Hello, nursery. So this week we're going to be learning about another job. We've learnt before the holidays about firefighters and what their job included. And this time we're going to be learning about some other jobs. And the first one is about doctors, people who help us. This is a really important job, the doctor. I'm going to read you this book, and it's got some really useful information about what the doctor does in her job or his job. So anyone can be a doctor as long as you work hard and find out lots and lots of information about body parts. You've got lots of learning to do to become a doctor. So let's have a little look inside the book. That rhymed. Now, I've got a smaller camera at the moment. Let me see. That's better. So let's have a little look inside the little book. And the title is Doctor. Busy people, doctor. Now this is the picture here of a doctor, and it's got some writing at the bottom. They're the authors' names, Ando Twin and Lucy M. George. And already it's giving us a clue about what the story's about, because you can see there is somebody with a special tool looking into a little boy's ear. And that is the doctor. He's sat on a little doctor's bed, probably in the doctor's surgery. But let's find out, shall we? We'll open up the book and have a look. Turn the pages very carefully. And there is the doctor. And that word, remember we read our words from left to right, that word says doctor. Doctor. Okay, so let's find out all about her job. Okay, Dr. Miranda works in a GP practice. She helps make people better when they feel ill or have been hurt. So that's what a doctor does. Good morning, doctor, says the receptionist. So in her surgery, there's a receptionist who takes the telephone calls to say, hello, how can I help you? And it might be somebody who needs an appointment or somebody who has someone who's ill with them and they need a doctor. So that's what they phone up for, or they might be phoning up to find out something, but we'll find out later in the book about that. You have lots of people to see. It's going to be a busy day, says the receptionist. So she's got a list of people who are all coming to see the doctor today. This is the waiting room in the surgery. Dr. Miranda's first patient has a swollen ankle. Now the ankle is that joint, that bone there, and it joins the foot to the leg, the ankle. Oh dear, Olivia, can I have a look? Asked Dr. Miranda gently. So she has to take a look at something to see if she can figure out what is wrong with that poorly patient. That's what the doctor does. She tries to find out what's wrong. He feels Olivia's leg and ankle, asking her where it hurts the most. So she'll just touch the leg and she'll say, does it hurt here? There? Where does it hurt the most? Until she finds out where the problem is. Dr. Miranda thinks Olivia needs an X-ray. Do you know what an X-ray is? An X-ray is a special photograph, and this special photograph is one that can see through bones, see through bodies, see the bones. It's a special big machine that takes photographs which look through into the bones of your body. It's very clever. He tells Olivia's mummy to take her to the hospital. So they've been to the doctor's surgery, but they need to go to the hospital now. That's where lots more doctors are and where a special person called a radiographer who takes the X-ray is. So they have to go to the hospital, says the doctor. Just to make sure nothing is broken, says Dr. Miranda. So it might not be broken, the bone might be okay, but just to make sure she needs an X-ray to check. Next, Dr. Miranda gives twin babies their injections. Children, do you know what an injection is? Injection. That means it's a needle with some special, whatever it is in, to make them not catch a disease. Okay, so the injection into their body is a needle that goes into their arm or sometimes into their leg, but it will help prevent them from getting anything. It will keep them well. Okay, these injections. He sees a boy with a bad case of chicken pox. He's got spots all over him. Can you see in the picture? Look at his arms. He's got spots all over him. They're called chicken pox. You might have had chicken pox. I think I know one person in our nursery who's had chicken pox. He checks a pregnant woman's blood pressure. So this lady's having a baby, and you've got to keep checking that the blood pressure, the blood is going round at a good rate, not going too fast or too slow. Okay, so they put a special thing round her arm, pump it up till it goes really tight on her arm, and you can feel how fast the blood is flowing through. And she listens to a man's chest with her stethoscope. So this special tool here, she puts one in each ear, and then she puts the metal piece on his chest, and she listens. And she has to be very still to listen, very quiet. And then she hears boom, 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 boom. She hears his heartbeat through the stethoscope. She listens for any crackles or any noises in his chest, make sure he's okay. Now Dr. Miranda has to call patients who are too poorly to leave home. So she doesn't just see patients in her home, in a surgery. She sometimes speaks to them on the telephone and asks them questions that way to find out what's wrong with them. She asks them questions and then decides how she can help them. So that's what she does as well. Dr. Miranda is about to go and have lunch when the receptionist rushes in. Can you see one more patient this morning, doctor? She asks. Jimmy has just arrived at the surgery for an emergency appointment. His daddy explains that he has a cough and a high temperature. Dr. Miranda asks whether Jimmy has a rash or any other symptoms. Poor Jimmy, look at the picture there. Oh dear, he doesn't look very well. No, he's just been sleeping a lot today, haven't you, Jimmy? Says his daddy. So now the doctor has to find out what is wrong with Jimmy. Dr. Miranda takes Jimmy's temperature with a thermometer. This is the picture. There's the thermometer. Can you say thermometer? Thermometer. It's a long word, 4 syllables. Long word. Thermometer goes in his ear. Beep. Has a look and says how hot or cold he is. And if he's too hot, then there's a problem. Then she looks in his ears with an otoscope. There is a special otoscope. Can you say otoscope? Otoscope. Well done. Say ah. In this picture, she's getting him to open his mouth and say ah. Ah, Jimmy says, opening his mouth wide. Oh, poor Jimmy does not look very well in that. Then she looks at the back of his throat using a special stick. So if you look in that picture there, she's using a special stick. And that stick can just keep his tongue down so she can see right at the back of his throat. Because it could be that he has a sore throat. Next, Dr. Miranda asked Jimmy to sit on the bed and take off his jumper. So this is the doctor's bed there. And Dr. Miranda listens carefully to Jimmy's chest using a stethoscope. So this time she's using a stethoscope to see if she can listen to his chest, make sure there's no crackles, make sure his heart sounds like it's beating properly. It feels cold and it tickles because that's a little round metal piece, and it is very cold on his bare skin. Dr. Miranda thinks Jimmy has a chest infection, so that's what she thinks wrong with him. She writes him a prescription for some medicine and asked him to come back in a couple of days if he's not better. So a prescription is a special piece of paper, and it tells the chemist what medicine to put in a little tub, or what medicine to put in a little bottle. He'll be having bottle probably, but when you get more grown up, you have little pills, and you only take those pills when the doctor tells you to. Or if you're a little child, when your mummies or daddies tell you you need your medicine, that's when you take your medicine, and the doctor will have told them first, usually, unless it's Calpol, which you probably have had before. Let's see where we're up to. You should feel well again very soon, she tells little Jimmy, waving goodbye. Thank you, doctor, says Jimmy. So she did all that investigating, using her otoscope in his ear, a spatula on his tongue, looking at his throat, the stethoscope on his back. She did on the thermometer in his ear. She did all the investigation and then decided what was wrong from what she heard on his chest, and decided he had a chest infection and needed some special medicine that would make him better. Dr. Miranda checks her afternoon schedule with the receptionist. So this receptionist is in charge of telling the doctor what she needs to do next, or who she needs to see. What a busy day it's been already. Dr. Miranda just has to make one more call before she can go out for lunch. Didn't she have a busy day already? It was only the morning. She'd had a busy morning, but she'd seen lots and lots of patients. She'd found out what was wrong with them. She told them what they needed to do to go and get better. So it might be that they need to go and get their leg checked at the hospital, or it might be that they needed some special medicine to make them better. And that's what the doctor does. They help to see what's wrong with us. They then help us to see what we need to do next to make us better and keep us better. They give injections by stopping us getting poorly. That helps us not get poorly. When we're babies, we have injections to stop us getting any diseases. And at the moment, with all our coronavirus germs, they're even more important because they're helping us by sort of sorting out whether we've got that virus or not. So, and giving us good advice, like washing our hands all the time. Very good advice. So this page is very good as well because it tells us what else the doctor does. So the doctor also goes to visit patients in their homes. They also send people to hospital, like they sent that little person with a poorly ankle to hospital. They give injections to stop people getting ill, like they gave the twins the injections, and they give people their test results. So it might be that they had to have a test to find out if they've got something. So then they phone them up and say, hello, this is Dr. Miranda. I'm just letting you know that your test is clear. You haven't got chickenpox or whatever. What does Dr. Miranda need? Oh, she needs her computer. Can you see this? She needs her computer because it's got lots of information and names in it that she needs. And also she can type in some medicines that she might need, and then it prints out her prescriptions when she needs that as well. She needs her tongue depressors. Oops, there they are. Like she used on that little boy, the tongue depressor, and an otoscope. She needs to look in people's ears. She needs her stethoscope, which she keeps around her neck. And then she also needs her prescription pad. So there's a prescription pad. And then she also needs a telephone because she might need to phone patients at home. She needs her thermometer to tell her how hot someone is, whether they've got a temperature. And I think, oh no, pen to write on a prescription pad. So she needs lots of things there. She's also got something here. That's a name badge, just so that everyone knows she is the real doctor. It's got her name badge. And there's other busy people who might help us as well. We might look at those another day, actually. So we've already touched on the receptionist. So if you want to set up a doctor's surgery in your house, you can pretend to be a doctor and you can dress up like a doctor. Now, some doctors, if you look at that picture, she's got a white coat on. They're usually worn when they're in hospitals, but nowadays they actually might wear just a t-shirt and like very comfy trousers, because they're so busy, especially in hospitals. They're so busy going from patient to patient that they wear things like a very loose fitting t-shirt and trousers. So that's what a doctor might wear. Or they might just wear their own clothes, very smartly dressed. That's what doctors wear. In the GP surgery, when I go to a doctor, the doctor usually has just got normal clothes on, maybe a jumper and trousers, but very smartly dressed. In the hospital, though, sometimes it's hard to decide whether they're a nurse or a doctor, because they might wear just the t-shirt on the top and look very similar to what the nurses wear, but they usually wear different coloured t-shirt and trousers. That's how you can tell. Okay, so that's all about the doctor's job. Okay, now tomorrow we will be learning more about the nurse's job, because that's a very important job as well. And these are all people who help us. And when you grow up, you might want to be a doctor or a nurse, because it's a very important job to help people, isn't it? So that's all about being a doctor. And now I'm going to go and set up a little hospital. I'm going to make a bed, a doctor's bed or a GP surgery. I'm going to have a little bed, might have my table and my chair, and put my pretend computer on the table with my pen and a little book, and turn it into a doctor's surgery. And maybe get a little case and make some things to go in it. Might have some things coming up of what to make to go in it, like a stethoscope. Okay, so let's see what's coming next on our home learning.